So ideally you want to put a 10% bleach water dwell on these arms after they've been used. And I'll show that process. When you're priming these arms, just remember we've got some bleach water in the veins. So be sure and open it up and let that drain as you're priming it with the red distilled water, or yeah, it's recommended only distilled water. And then I have a bag, and if you use the second port on that bag, like if you were setting up a pressure bag for pressure monitoring, you want to make sure you get the air out. And you want to use you don't want to use any tubing that has an anti-reflux valve. So when you unclamp these, they don't normally come with clamps, but I added clamps just because I keep making a mess. But where they were clamped, sometimes that tubing will pinch in on itself, and then it won't prime or drain. So just kind of look for that after you unclamp it. Move the clamp, make sure the tubing's not pinched to itself. And then I always pull back the little lure lock from the end of the tubing so that you can slide it in. If you need, I just use hand sanitizer to lubricate that so it slides on easier. And that way it evaporates and it doesn't stay slippery that way. So you got both clamps open, and you want to open your bag that has no air in the tubing, the side that you've actually got plugged in. And because this tubing doesn't have that anti-reflux valve on it, you can add additional fluid to the bags through any of your Y-Site injection ports so that you don't have to unspike and spike a new bag. And then just open your roller clamp and let it prime, and you can squeeze the bag if you need to. But just wait until the colored fluid starts coming out and then clamp it. I'm going to say that's my 10% bleach water. That just keeps the mold and mildew from building up. The mold and mildew can make like artificial valves inside this rubber tubing, so we definitely want to make sure that we don't let that occur. Okay, and then you just plug in your other tubing set, and then I'll show you the rest. So once you have your other tubing set plugged in, unclamp your line again, and then just open your other roller clamp. And it should reach an equilibrium. And then I just put my IV bag into a blood pressure cuff and pump it up to about between 60 and 80. And that way it keeps a positive pressure in those veins, so the students have the best success. And it's easier if you have the tubing come out from the opposite end of your blood pressure hoses. And I switched over to this because gravity, with the extra tubing hanging, students were getting hung up in it, yanking things up, and of course then you have red distilled water everywhere. So with this, I didn't have any trippage or disconnects during the labs or the practicum, so it worked pretty well, much better than gravity on an IV pole. Takes up less space as well. So I usually just keep the 10% bleach water in a tube feeding bag, so that way you can just connect it, just use a regular pad. Don't use linens. Try to avoid the red food coloring on the linens as much as possible. And then you can just open your clamps and open up your bleach water. Again, check to see if the tubing is crimped underneath the clamp. Which looks like it is. So once that runs clear, then just turn off your bleach water. And then close your clamps. And then you can disconnect. I like to create a little bit of positive pressure in the line before I clamp that last one. Okay. Then disconnect and then leave it on dwell. I usually do it for at least an hour, but you can always leave it for about a day. I wouldn't do it for more than one day. And then just run a 60 ml syringe of distilled water through it to rinse that bleach on out.